Hello friends, in this video we are going to see about the most important assessment in children soon after birth. Actually these vital parameters are to be measured and we have some criteria also which helps us to identify some of the problems related to the growth and development of the newborn in the beginning stages or earlier stages itself. These are known as anthropometric measurements. Let us see the meaning of it. What is anthropometric measurements? So these are a set of non-invasive quantitative body measurements used to assess growth, development, and health parameters of the newborn. And it helps providers to determine if a child is growing properly and can indicate when the child's health and well-being are at risk. And additionally, anthropometric measurements assist providers in selecting appropriate treatment options for children and adolescents. So this anthropometric measurements is not only for the newborn. We can use or we can adopt this technique to measure the growth and development related parameters right from newborn to the adolescent stage. And the significant aspect of this measurements which helps the healthcare providers to identify the problems in the beginning stages, as well as it helps to select the appropriate treatment options in order to correct those deficiencies. And there are 6 vital parameters are important and need to be measured under the anthropometric measurements. Those are length or height and weight, head circumference, chest circumference, abdominal circumference, and mid upper arm circumference, or MUAC. So let us start with the length of the baby. So to measure the recommended length, children under 24 months and children 24 to 36 months who cannot stand lying down on an infant measuring board that has a fixed headboard and a movable footboard. So length and height, there should not be any confusion, because up to 2 years or up to 24 months or sometimes 3 years also, when the baby is unable to stand or lie down on the fixed board, this method can be used because the baby is unable to stand and follow the commands or the instructions of the healthcare providers. We can go for this measuring of the length of the babies. So what we have to do is we have to remove any clothing that interferes with obtaining precise measurements such as shoes, booties, and bulky cloths before measuring the child. And we need 2 people to obtain this measurement, because when we place the baby on the scale to measure the length, due to the flexion of the extremities of the newborn, it is very hard to get the exact measurement of the length. So that's why we need the assistance of somebody else, either it may be healthcare provider or sometimes we can use the parent as well. One person aligns the infant's head against the top of the headboard, and the other person straightens the infant's body and the leg while helping the infant's feet pointed upward and parallel to the footboard. Bring the footboard against the bottom of the feet. So here the advantage is the footboard is adjustable, headboard is fixed. So according to the length of the baby we can adjust this footboard, and always we have to apply little pressure over the knee joint of the baby in order to make the knee point or the lower extremities straighten. So this is the infantometer or board. We have one headrest and the footrest, and the baby is placed. You can see there is no flexion of the extremities of the baby, and you can see the healthcare provider is applying little pressure over the knee joint so that the legs become straightened. And we have some normal expected measurements in the term babies. It is expected to be 50 centimeter length or 20 inches for the boys, and 49 centimeter or 19.6 inches for the girls. And the normal range for both sexes is from 47.5 to 53 centimeter. This is the expected range of length for the normal term babies by birth. And the second parameter is height or stature, we can say. So we can measure the height when the child is age 2 years and older, who can stand using a standard measuring board with a movable headboard that is called a stadiometer attached to a flat wall. And we have to measure the child wearing light clothing and without shoes and heavy socks. So request the child look forward and stand up straight with buttocks, shoulder blades and heels together touching the wall or stadiometer. Align the headboard perpendicular to the wall and lower headboard to the top of the child's head. So if you look into this illustration, it is very clear that you can see the head position and the eyes where it is facing and the position of the shoulder blades and the buttocks and the heels. So always the heel should be together. The buttocks and the shoulder of the child should have the touch with the wall or the stadiometer where it is fixed, and the head is in the middle position and the line of vision parallel to the floor. So this is the exact position if you want to measure the height or stature of the children. And the instrument what we are using to measure height is called stadiometer. Sometimes what happens when we don't have stadiometer but we want to assess the height of the children, so immediately we can use the flat wall to measure this height. You can place the child near to the flat wall, and first you take the head end of the children, just mark it somewhere with the use of scale or pencil, something you can use, and mark it, and with the use of inch tape or measuring tape you can measure the length height from the head end to the foot end. Okay, this is the instant measure if you don't have any stadiometer or any fixed devices to measure the height of the children. This can be the alternative method. And the next parameter is about weight. So children less than 2 years of age, weigh the child without cloths or diapers using a calibrated beam or digital infant scale. Position child in the center of the scale tray. And if the child is more than 2 years of age, weigh the child on a calibrated beam, balanced floor scale or electronic floor scale. And for older children and young children, when privacy is a concern, weigh the child wearing minimal indoor clothing and without shoes. And request the child or adolescent stand in the center of the platform of the scale and remain motionless until the measurement can be obtained. So in order to weight the baby, first we have to see what kind of cloth they are wearing, whether it is very light cloth or there is a has some weight. So in that case, sometimes we have to measure the cloth weight first, then we have to measure the weight of the child, and finally once the both weight is calculated, you can subtract the cloth weight from the total weight from the total weight of the baby. So you are going to get the exact weight of the children, and it is expected to be 2.5 kg to 3.7 kg, the average birth weight of Indian babies. So this is the infant weighing scale, and before we start the procedure, we have to see whether the instrument is in functioning condition or it is functional or have any deficits. The parts are working properly, and we have to see sometimes the flat board, we have to spread some cloths before placing the baby, because we are exposing the baby to the external temperature and it should not affect the thermoregulation process of the baby. So we should be very conscious, and we should not take much time to measure the weight, and as early as possible we have to measure the weight and we have to return the baby to the child parents. And we have some formulas to calculate the weight of the children according to the age. If the baby is aged between 3 to 12 months, then we can use the formula weight in kg is equal to age in months plus 9 divided by 2. And if the child is aged between 1 to 6 years, then the formula will be weight in kg is equal to 2 into age in years plus 8. And for the children aged between 7 to 12 years, weight in kg is equal to 7 into age in years minus 5 divided by 2. So these are the three formulas you can use according to the age of the children when the exact weight is not known or weight is needed to calculate for the treatment purpose or for the dosage calculation or something else. These formulas can be applied. Another most important parameter is about head circumference. So how to measure this head circumference? We have to place the measuring tape anteriorly over the supraorbital ridges just above the eyes and posteriorly over the occipital prominence. The illustration says the both locations, that anteriorly the frontal bone and posteriorly the occiput region. And if a child has hydrocephalus, serial measurements should be made in order to know the changes in head circumference. And the normal head circumference in the normal term newborn baby, it is between 33 to 35 centimeter. So this is the right technique of measuring the head circumference. And most of the time the child may not be cooperative. So what we have to do is we have to place the baby on the lap of the mother. So the child will have some psychological support. Then the measurement can be taken even in sitting position or in a lying position. Another one is chest circumference. How to measure this? At mid respiration, the circumference of the chest is measured at the level of the nipple line just under the axilla. And the tape measure is placed at a right angle to the vertebral column. And the normal measurement should be between 30 to 33 centimeter. Okay, this is about the chest circumference. And abdominal circumference. The measurement is made on a recombinant infant at the level of the umbilicus, and the abdomen of the children up to 3 years of age who have chronic intestinal problems is measured. Normal abdominal circumference is between 31 to 33 centimeter in normal term newborns. This is about abdominal circumference. And finally, the most important parameter of the anthropometric measurement, it is called mid upper arm circumference. Of children aged between 6 months to 5 years of age. This can be measured, and it gives some indication of the degree of wasting the child has. And circumference of the left upper arm and is measured at the midpoint between the tips of the shoulder and the elbow. So this is the technique. Let us see how to measure this MUAC. Bend the left arm and find and mark with a pen the olecranon process and acromion process. And these two anatomical regions we have to find out. Then mark the midpoint between those two marks, and with the arm hanging straight down, wrap a MUAC tape around the arm at the midpoint mark. So this illustration shows very clearly how to measure this mid upper arm circumference. First we have to find out the anatomical points, that is acromion process of the shoulder and the olecranon process of the elbow. And the arm should be in a bend position. And between these two areas, we have to find out the midpoint and you have to mark with pen. And once you have identified the midpoint, then you can use the special tape called Shakir tape to measure the mid upper arm circumference. And MUAC is 9 to 11 centimeter at birth in term neonate. It grows to 16 centimeter by the end of first year of life. And if you see the cutoff points according to the color codes, if the measurement is in red color, then that is 0 to 11.5 centimeter, and yellow it is 11.5 centimeter to 12.5 centimeter, and the green color code indicate that is from 12.5 centimeter and above. And this is the tape called Shakir tape and has the measurements here with the three color codes: red, yellow, and green. So red is it is severe acute malnutrition if the measurement is less than 12.5. Then yellow, that is moderate acute malnutrition, and green is no acute malnutrition, that is more than 12.5 centimeter. This is about the measurement of mid upper arm circumference using Shakir tape. So that's all about the anthropometric measurements in children. So it is most important assessment. So any assessment without anthropometric measurements, it is not going to give exact results. So as a healthcare provider, as a nurse, we must know how to measure this anthropometric measurements. Thank you.